Morning, Dr. Save.
Morning, sir.
So, we want to discuss about the corona pandemic from a different perspective today. We already know that around 4.8 million people of the 7.5 billion people are affected by corona positive infection. And yet the impact beyond the physical on the minds of the people has been practically universal. So my question to you would be that as a senior practicing psychiatrist for the last 20 years, what has been your experience as to the impact of this virus on the psychological health of the people in society today?
It's a very interesting question. You said that 4.8 million people have been affected by the virus.
Yeah.
But minds of almost this 7.8 billion, I would say at least 7 billion, has been affected by this virus.
True.
People have been just talking about this virus continuously, thinking about this virus continuously, anticipating that what can go wrong in their life because of this virus and the repercussions of it. During the initial phase, I saw people telling me about the virus and if it comes to me, then what would happen. Now they are talking about what would happen if they lose their jobs, their businesses, how the family would sustain. Workers have taken off from the city, finding their own solutions. Other day I heard of some people taking cycles and going on a 2000 kilometer cycle ride. So they have left on their cycle not for any other reason, but for the reason of fear.
Correct.
That more worse is going to come. They were in Mumbai, they were receiving their food, they were eating. It's not that they were not eating. They have chosen that month's cycle ride, not thinking about the punctures, not thinking about where to sleep, not thinking about what to eat, out of sheer fear. So if you can see that fear is really getting into people's mind. And this anticipatory fear is combined with two more things psychologically speaking. One is catastrophizing. That means more worse will come, more worse will come.
Yep.
And paranoia, that it is there everywhere. This will affect me, that will affect me, this is bad going to happen to me, that is going to bad happen to me. And this combination is really affecting the mind very adversely. When a person, the mind is made in such a way that it continuously thinks except for the time when we are sleeping, we are working or we are talking.
Right.
Every human being would be thinking.
Right.
And what exactly thinking is that he just talks with himself. So man is always talking, sometimes with another person, or sleeping, working, or talking to himself.
Right.
Now if somebody comes and starts scaring you, wouldn't you feel scared? Today every human being is doing that to himself. And whatever others' words, they fall first on our ears, we filter it and put it into our mind. Own's words, they directly fall into your head. So the thought that I will get corona is going to feel real to me. If somebody else says, "Arey corona ho sakta hai," I may say कि मैं precaution ले लूँगा. The effect of this one's own words is having a very, very negative effect, and we are continuously talking about this one single thing. And ultimately what is happening now is that the brain is getting exhausted. It is also a part of body.
Mental exhaustion.
Just like hands or feet, if you just go on walking for 100 kilometers, your legs are going to feel tired. You have done that with your mind. You're continuously thinking the same thing, same thing, same thing, same thing. Just one part of the mind is continuously being used and it has become tired. And its effects are coming out on the body and mind.
Sure.
Sir, in fact, the effect of mind on body, that is mind is on body, which is called soma, is called as somatization. Are you seeing patients with this somatization, the effect of mind on body? And in what way are they coming to you? You must be seeing, because I know you must be seeing.
In fact, it came as a big surprise last 3 weeks when I've been starting full-fledged OPD, that people started coming with symptoms to a physician which were of mental origin but were experienced at the body level. For example, they would tell me hyperacidity, indigestion, excessive gas formation with no previous GI symptoms, right? Reflux symptoms, tightness of chest, ghabrahat, palpitations,
True.
right? Restlessness. Then they would talk about unprecedented headaches. Some people would talk about, for example, sleeplessness. Then the whole body becoming tight, muscles becoming tight, right? So these are all symptoms which are obviously coming of mental origin, but were reflected on the body, what we call as convergent reaction.
No, I've seen a lot of sleep and appetite disturbances, irritability, no, negative thinking. No, these symptoms also coming up at the level of mind in a lot of patients.
Do you see any particular pattern of people who are more vulnerable to this particular affection? And maybe there are some people who are more resilient to this syndrome. Do you see a differentiation?
Definitely I've seen. People who are originally anxious by nature, I've seen that they are very, very affected. One interesting group of people which I found where disciplined people are comparatively less affected.
Yeah.
But the funnier part is that over-disciplined people are also again very affected by this. Because those who are strictly following their routine,
Like a rigid.
the rigid kind of people, who don't want their routine to go here to there, are those who are very much more affected. One group of people whom I have seen who are comparatively much more resilient and also working and having a smile on their face are those with a sound spiritual base.
Interesting.
Now, I have spoken with few of them. They have explained things to me also because they have a faith that they would be taken care of. They have this more disciplined lifestyle, and it is not just faith and lifestyle, but they also indulge into regular yoga, meditations, pranayams on a very, very regular basis.
Correct.
And this has really helped them a lot.
Makes sense. So, would you subject all your patients to, I mean, you said all these symptoms are coming from the mind. Is every patient coming to you in this eligible a candidate for psychiatric intervention in the form of antipsychotic drugs or anti-anxiety drugs or antidepressant drugs? Or what would be your approach?
Sir, drugs are to be given to a psychiatric disorder patient only. Being affected by a stress does not convert into a psychiatric disorder. As you said rightly, that the mind has got an effect on his acidity. We would be treating him with anti-acidity, or we will be telling him the measures of treating him with acidity for his acidity. Similarly, in case this person has got converted into a psychiatric disorder, then definitely he requires to be treated by a psychiatrist or a psychologist. But what we need to understand that all of these people need to be treated for stress, which is very important, that you need to be treated for the mechanisms in which you can reduce the stress, the effect of stress on your body, and how to become more resilient. And that is more important than being treated with a psychiatric drug.
So, non-drug therapies.
Non-drug therapies. I'll tell you just couple of 2-3 points which will make you decide whether you have a disorder or not. One is that the symptoms should be continuous and for more than 2 weeks. Sleep appetite should be disturbed. Third is that energy levels should be continuously disturbed. And it should start affecting your physical, personal, interpersonal and occupational functioning.
Correct.
So if these things are happening, definitely you can think about consulting a psychiatrist or a psychologist to evaluate yourself. But if these things are not happening, and then it is what is happening to everybody.
Correct.
It is not a disorder, it's just a reaction.
Right.
In fact, more than me, I have seen you treating people very, very effectively, extremely effectively with non-psychiatric drug intervention. So could you tell us a few things to change your body's strength towards fighting stress as well as the mind's strength to...
Yeah, I think that the world has really realized that the immunity of the body and the psychological resilience is a very important factor in counteracting the whole thing. So measures to really understand scientifically how to really avoid the virus is one behavior, but more than that, the host factors of how to make the body more strong. So, like we always heard from our elders that early to bed, early to rise makes you healthy, wealthy, wise. Now this is a time to really practice that. Now sleep early, get up early, and use the morning time which you have, little extra time, maybe hour or two, right, in prayer,
Great.
in meditation,
Right.
in yoga, right, and therefore, or maybe even sunbathing, right. In this way, let your body become more strong, let the mind become more stable and peaceful, and let your soul get a sense of direction and purpose in life. This really is a holistic model to really make a person through and through, very, very resilient to all sorts of challenges which the day will bring once he leaves the house. A few things about diet. In diet there is supposed to be something called as pro-inflammatory diet and anti-inflammatory diet. So since corona kills people by a huge inflammatory reaction which leads to thrombosis and a cytokine storm, etc. So just eating a diet which is more anti-inflammatory, that means reducing significantly the animal-based products. We can stick to our own traditional foods, maybe Punjabi, Gujarati, Marwadi, so much to satisfy and gratify our tongues as there. Good sleep is going to help. A good 7-hour sleep would really be important in making the body more stronger. Drink enough water. It's going to be summer now, and at least 2 to 2.5 liters of water, or maybe more, so you flush your body of all toxins, right? Perform Surya Namaskar would be another thing to really make it's a whole body exercise. And since we are living in an era of artificial farming techniques leading to a lot of loss of nutrition in the food, a few supplements will help. So the anti-inflammatory cocktail, what you can call, is vitamins A, C, E, and D. Okay. And along with supplements of a mineral nature, mineral supplements, specifically selenium, magnesium, and zinc. Mm-hmm. So once you take a combination of these, you can take it from a family physician, and then that really creates an ability to really counteract the toxins produced by the virus and make the body more antioxidantally strong.
So very nice. I think this particular thing is also going to help people, and along with that, as I said, keeping a track of what you're talking to your mind.
And don't watch the news all the time.
Yes. please don't watch the news. I'll tell you, we have so many people, including our doctors, who keep complete track of corona. You ask them and they'll tell you the exact number of patients in Mumbai, in Maharashtra, in Karnataka, in New Jersey, in...
It's like how you used to keep track of how many runs somebody Gavaskar made or Saurav Ganguly has made, right? Like that.
So, and then this corona by WhatsApp University, which talks about positive things, negative things, spreads what sorts of rumors. They are all affecting your mind. And please, as I said, one thing, if you continuously go on thinking, is going to exhaust your brain. Start diverting off to other things. It's very, very important. We need to do that.
How did you use your time during this lockdown period? What did you do extra which is different?
Sir, very frankly speaking, I have always been for years together saying that I'm so overworked. I've always been working, continuously working. I want a vacation. And so many other friends of mine also, I have heard them speaking this.
Same thing.
And now we have been given this vacation.
Yeah.
And now that we have got this vacation, instead of using it, we have become sad. We are worried. We are thinking about future. Rather enjoy the moment.
Be in the present.
Be in the present. There have been, has given you time and opportunity. Time to do things which you always wanted to do. Opportunity to come out as a better person. Stress will always have two outcomes. One is you become distressed, that is, react in a negative way and come out as a weaker person, mentally, physically broken. Or use stress, which you really use to fight it and come out as a stronger person. And next time, that stress level is going to be easy for you to manage.
Correct.
So this is the time when we have to use that. Regular exercise, spending time with family, learning new hobbies. I have started cooking with my wife. It is really making her happy, because not because I'm sharing the work responsibility, because I'm there with her. She loves.
Is it a globe or is it a map of India? Your chapatis.
It was a map of India. Now it is nearing the globe, but it has still not become globe. But I know the technique of making it. I know the technique of even and it is so nice. My exercise also comprises of jadu pocha. But jokes, this is really going on. But apart from this, spending time with family, talking with them, playing some games, doing something innovative, doing something new, learning new techniques, they all are helping people if you do that. And Corona is not just one situation which has really made things very, very worse at the level of health, economy, other things. But it has also cleaned up the environment.
Right.
We have learned social distancing. I think the future of viral infections is going to be really bleaky. There will be less influenza.
Correct.
Even people are, if they continue with their healthy lifestyle, cardiac illnesses, strokes,
They are already reducing.
they are already reducing. They'll reduce further. And we will learn to become stronger and live in adverse situations, live with lesser money. We don't require that much money is also what has been learnt in this.
Very true.
We don't require to go and buy things for happiness or eat in hotels every now and then is what we have learnt.
Sure.
And it is giving us so much of happiness. 2 months of no shopping and still people are happier.
Right.
So we are going to learn so many new things. From the economic perspective, I would say that once economy opens, please shop because it will give us a boost. But I'm telling the other perspective also.
Right.
So what would you say about this?
Well, I was thinking about this deeply myself, and what came to my mind was the example of the trees in the northern provinces. In the season of fall, winter, all the leaves are lost, and the tree looks dry, leafless, almost dead. But the tree does not give up. The tree keeps on taking nutrition from the ground and waits for that good time when the sun will start shining again. And once the sun shines again, after a few weeks, months, right, again life bursts forth from the trees in the form of new leaves, branches, foliage, flowers, and even fruits. And again, it is full of life. I think that's the way I would look at the corona pandemic, that it'll all eventually, with the right attitude, right measures, and whatever we need to do, we do. But we still don't become hopeless. We remain hopeful like the tree, because everything will eventually come to pass.
So even history has told us the same. After 2019 flu pandemic, the next decade saw a huge growth.
Right.
So much of production that in 29 that great deflation came. After that also again it saw growth. After 1945 World War, companies like countries like Japan, Germany were absolutely in troubles. But by 50s,
They bounced
Germany
back.
was manufacturing more cars.
They bounced back.
Japan was more bounced back. Even 2008 economic crisis. After that, see the last decade. So this bounce back is going to be even greater than all these.
Wonderful.
I think we have to be optimistic and come out of this as stronger person, not break down.
Wonderful. It was wonderful talking to you, Dr. Save.
Thank you, sir. It was same. Thanks.
Thank you.
Thank you. Thank you.